All right, let's get right into it. Today, we're going to take a visual walkthrough of what happens when pressure builds up inside the skull. The goal here is to give you a really clear, step-by-step mental model of this whole process, something you can actually visualize when you're thinking about it for an exam. Okay, let's dive in. It really all kicks off with this one simple, kind of terrifying question. See, unlike pretty much any other organ, your brain is stuck inside a hard, rigid box, the skull. So when something goes wrong and it starts to swell, it literally has nowhere to go. And that one fact, right there, is the key to this whole dangerous cascade we're about to explore. And this is that box. The skull's got a fixed volume, and it's already full. It's packed with three things: brain tissue, blood, and cerebrospinal fluid, or CSF. Now, normally, these three are in this perfect, delicate balance. But if one of them starts to take up more space, something else has to give. Something's got to get squeezed out to keep the pressure from going up. The problem? There's almost no wiggle room to begin with.
So what could possibly throw that delicate balance off? Well, it could be any one of these things. A tumor starts growing and boom, it's taking up space. Or you have cerebral edema, swelling from an injury that adds a bunch of fluid. A bleed starts filling the skull with blood. Any one of these is adding volume to that closed box, and that's the trigger that kicks off the body's really desperate attempt to compensate. And that brings us to the real heart of our walkthrough, the 4 stages of increased intracranial pressure, or ICP. This isn't something that just happens all at once. Nope, it's more like a story that unfolds in a very predictable and escalating sequence. So let's break it down, stage by stage. Okay, so in stage 1, the body is coping. It's smart. It pushes some venous blood and CSF out to make room, and the pressure stays stable. But then we hit stage 2, and those tricks start to fail. The pressure starts creeping up, brain cells aren't getting enough oxygen, and the body tries to fight back by jacking up blood pressure. Stage 3, though, that's the crisis point. Compensation totally fails, the brain is starved for oxygen, and it loses its ability to self-regulate. And finally, stage 4 is the end game, herniation. The pressure gets so intense it physically pushes the brain around, and that leads to catastrophe. And this graph, wow, it just illustrates that story perfectly. Look at this. In stages 1 and 2, that pressure line is pretty flat, right? The body's fighting and it's holding its own. But do you see that cliff edge right at the start of stage 3? That is the exact moment compensation fails. The pressure doesn't just rise, it skyrockets. This picture is so critical to remember because it shows you that the switch from coping to catastrophe is terrifyingly fast. So what is that tipping point exactly? It's the failure of something called autoregulation. Think of it like a dam that perfectly controls water flow to a city. Normally, the brain's blood vessels can tighten or relax to keep blood flow perfectly steady, no matter what your body's blood pressure is doing. But when that intracranial pressure gets too high, the dam breaks. The vessels lose control, and you get this vicious cycle of more swelling, which means more pressure, and paradoxically, even less blood flow. This is the moment the brain loses its own control system. Okay, so we've seen what's happening on the inside of the skull, but how does that actually look on the outside, in a patient? Well, that rising pressure sets off a whole series of alarms. These are the clinical signs and symptoms that map directly to what's going on inside. Let's look at how they show up. The very first, and I mean the most important alarm bell, is a change in the patient's level of consciousness. It is the most sensitive indicator we have, period. Even really subtle things, like a little bit of confusion or restlessness, that's our first clue that the pressure is starting to mess with the brain's arousal systems. And this isn't random. The decline follows a really predictable path, which is super important for exams. A patient might start out just confused, then slip into lethargy, then stupor, and finally coma. Now, why that specific order? Because it's a direct result of that increasing pressure physically squishing the parts of the brainstem that control wakefulness right from the top down. Now, this is where it gets really fascinating. The breathing patterns can actually give us a roadmap of the damage. As that pressure forces the brain downwards, it hits the brainstem from top to bottom. So early on, you might see Cheyne-Stokes breathing as the higher structures are affected. Then, as the pressure hits the midbrain, you might get that central neurogenic hyperventilation. And finally, when the medulla, the most primitive breathing center, is getting compressed, you see that chaotic, ataxic breathing. These patterns are a direct signal of exactly where the pressure is doing the most damage. And just like breathing, the pupils give us a direct window right into the brainstem. That's because the nerves that control the pupils run right through it. So if you see tiny, pinpoint pupils, that points to damage in the pons. If one pupil suddenly blows out, it gets dilated and fixed, that often means a cranial nerve is getting compressed on that side. Watching the pupils is like getting a live feed of the location and severity of the injury. And finally, we get these motor responses. These are primitive reflexive postures that only show up when the higher brain functions are knocked out. Decorticate posturing, where the arms flex in towards the core of the body, tells us the damage is still above the midbrain. But decerebrate posturing, where the arms extend out, tells us the damage has progressed deeper into the brainstem. The absolute crucial point here is that decerebrate is a much more ominous sign. It means the injury is more severe. All of these signs we've just talked about, the drop in consciousness, the weird breathing, the pupil changes, they are all massive warning signs. They're basically screaming at us that we are approaching the final, catastrophic stage of this whole process, brain herniation. So what exactly is herniation? Well, it's a simple and totally brutal mechanical process. It's just physics. The pressure inside that closed box gets so incredibly high that it physically squeezes and shoves brain tissue into places it does not belong. And as it moves, it crushes blood vessels and vital nerve centers, causing damage that you just can't come back from. I mean, just look at this image. This is the physical reality of everything we've been describing. You can literally see the shift, the compression, the complete distortion of the brain's normal shape. This isn't some subtle chemical issue anymore. It's a physical displacement of tissue that is strangling its own blood supply. And this is what it all comes down to. This is the final stark equation. The body is desperately trying to pump blood into the brain with arterial pressure, but the pressure inside the brain is pushing back with the exact same amount of force. When those two pressures are equal, blood flow just stops. Game over. Without blood flow, the brain dies. So, we've walked through the entire cascade, from that first little increase in volume all the way to the complete stop of blood flow. I'll leave you with this question to really think about. Now that you can visualize this whole progression, from compensation to catastrophe, where are the most critical moments to step in and actually change the outcome? Understanding this timeline isn't just about passing an exam. It's about understanding how to save a life.